What size is ideal for a veterinary endoscope?
1mm scope with a channel that is 1.2.
With operative channel 1.2 millimeters.
I'm using at this moment the 2.1 millimeter.
And we've just tried this scope with 2.1 millimeter.
1.2 millimeter working channel.
To the urinary system, respiratory system, so rinoscopy, broncoscopy.
Treat for male dog urethropy.
Suitable for various animals.
Hi, I'm Dr. Simone Monti from Italy. I work in Clínica veterinaria that is the place where I usually work, and I've spent the last, I think, 20 years doing endoscopy and laparoscopy, and at last we have a nice instrument to work with, because we've always had troubles with the dimension of our patients, because usually it's quite smaller than what we thought. So more than anything, for the urinary tract, for particularly narrow places, I feel like we have a really nice instrument that is a 2.1 millimeters scope with a channel that is 1.2 that permits us to retrieve sample, to have biopsies, and so this my work would really benefit from an instrument like that, because I can reach structures that before this instrument will require maybe open surgery or anyway some more invasive procedure than just endoscopy. So I'm quite happy to have it in my hands, and I hope to use it as much as I can in the next future.
I'm Dr. Rui from Portugal. I work in the veterinary hospital of the university in Lisbon, and we've just tried this scope with 2.1 millimeters in a patient who had a respiratory disease, in which a cat, small cat, in which it proved very useful due to its small size, to allow us to see the nasopharynx. And in terms of utility, it seems very distant, and probably we will use it a lot also to the urinary system exploration, especially in small dogs and cats. Very interesting to use, and the Dormia basket goes through it smoothly. It's very good material. Yeah.
I'm Dr. Marco Ghirighetti. I'm the Master of Second Degree University in gastroenterology and endoscopy of small animals. And I test today this scope, and it's very useful for my practice, because the scope is very thin. It's a 2.1 millimeters with operative channel 1.2 millimeters. So it's very useful. I test on my dog, a little dog about 3 kilos and a half, and it was very useful to pass through the tracheotube. I can do a bronchoalveolar lavage. I can do with no trouble an exploration of nasopharynx. It's very useful for my practice. I use on this big monitor, and the image was very wonderful. It's very useful and easy to detach and to connect without no problem, and there's a good flexibility. And here is 285. So it's wonderful to do the reverse exploration of a nasopharynx. So it's for me it's a very good and useful endoscope to use for freelance, because for freelance it's very easy to take endoscope. I can take in small bores. No problem.
Hi everyone, Daiana Breitenbach here. I'm from University of Lisbon, Lusófona, and I want to share with you some of my clinical thoughts about this new endoscope of 2.1 millimeters. This endoscope was a game changer for me. It allowed me to do much more investigation in small animals as cats and small breeds of dogs, because it allowed me to go directly in places that I cannot go with the other ones. Regarding the image, give me a really good quality of image. I can assess all that I need to do, all I need to assess during the exam. And even for my classes, it's really important because I can capture important image and teach the students properly how to perform some of the procedures. I think it will be a really game changer. I'm even using it in my PhD research at this moment because it allows me to access to information that wasn't possible with other endoscopes. So I'm using at this moment the 2.1 millimeters to the urinary system, respiratory system, so rinoscopy, broncoscopy, and small animals too. And even sometimes with ears, when we have a bigger stenosis in the channel, I can use a 2.1 to get there. It's not that easy sometimes, okay? So it's been really versatile for me. And for exotic patients too, there is a really good option because we can have it in a different size, not that big, even a little bit smaller. It's really a good option for us to use it.
2.1 millimeter outer diameter and 1.2 millimeter working channel, and you can see it has a very nice picture. You can also use it in rinoscopy. You can go up into the frontal sinus. You can use it for broncoscopy, even in very small animals. So this is a very useful endoscope.